Tray Chamberlin. I'm a principal at the Alexander Group, and I lead our digital health practice. And so at the Alexander Group, we do revenue growth consulting, in particular helping digital health organizations essentially kind of streamline and optimize their top line sales, marketing, and service functions. Absolutely. We have seen a pretty codified path. Now, outside a couple unicorns and very large organizations with significant outside investment, we've seen most digital health organizations kind of follow this very kind of three-step process where in many times it's mandated by product maturity. Oftentimes you have a founder-led organization and the founder, he or she, as well as maybe their marketing lead or their product development lead or whatever it is, going out and selling the product and connecting with payers and providers. But as certainly top-line revenue growth is expected, what usually happens is kind of this maturation into the investment in a professional sales force, actually dedicating costs back to hiring a single seller or maybe a handful of sellers out into the market. These sellers, for the most part, are kind of the single conduit back to the company. They represent prospecting, persuasion, even billing questions and post-implementation support, and so they kind of become this choke point. Then as usually organizations grow and they might add products to their portfolio, you see this professionalization mature where you see what we consider a more evolved commercial model. And usually those evolved commercial models kind of have a couple trademarks or hallmarks that we see, which is, well, first and foremost, you start surrounding that core selling rep with ancillary resources. It might be a business development rep. It might be a product specialist that comes and essentially helps to support the selling motion and the awareness motion overall. The second thing we're also seeing is a lot of times it's a bifurcation of land and expand activities. And what I mean by that is you might have a sales team or a group of individuals that is focusing on net new logo acquisition. How do we go out and find new customers to buy our solutions? And then you might have also the post-land team that is thinking about how do we continue to make sure that our existing buyers are getting the value they need out of our products and continue to buy and therefore also renew, especially in a subscription-oriented model. And so you kind of see this land and post-land motion and the bifurcation there. And kind of the last hallmark we start to see a good bit is the proliferation of the customer success manager, essentially those resources that are there just focusing almost exclusively on value realization, product adoption. But what we'd also say is there's two flavors of the customer success manager. You have revenue responsible. I might have responsibility for renewal numbers or upsell, cross-sell activities, and revenue influencing customer success managers that are much more so inclined towards customer outcomes, but actually don't have a significant ownership in commercial metrics like NRR or even incremental revenue or bookings. The first thing to start off with is there's no single go-to-market model that we would say works for everyone. We've inventoried about 15 different archetypes in the marketplace, and there's multiple iterations of each of those 15. However, when we kind of look at the most successful organization, there's three traits that we see for the most part. So we'll start to see a focus on solution selling, moving away from product and features. Hey, when I go to a provider and say, hello provider, my product might do A, B, C, or D, instead shifting the conversation to say, my product will help you solve X. Now, a lot of the times that value prop is very solely focused on provider or HCP enablement, making sure that we're supporting our physicians and clinicians to do their work. And so that's usually the number one need we see a lot, but certainly just kind of focusing more on solutions as opposed to products and features. The second piece is just really focusing on not just how can I tell you how my product is going to help you, but also making sure that the product gets implemented. The worst possible success story from a selling perspective is convincing stakeholders and purchasers that our product is great and them signing off, but the solution never being implemented or used to its fullest value. And the last thing we would say in addition to that is also we see organizations that outperform their peers, for the most part, really have a ruthless adherence to metrics and measurements. trying new commercial strategies and then thinking about leading and lagging metrics that can then reinforce that we've had some success, or also refuting any level of success, and then also pivoting quickly. And so those are kind of three things we see very commonly. Yeah, and I would kind of focus on the second bullet point that I just went through, which is that focus on implementation and a high level of service. And really what that looks like is not just saying, hey, we believe in implementation, but actually putting programs and processes behind that, even in the sales process, to ensure you're getting adoption post-acquisition or post-persuasion or post-sale, however you want to think about that. A very specific client example that we had recently was we actually installed an additional step, or kind of an additional checkbox, if you will, within the sales playbook and sales process. Make sure before that you get final sign off and the ink is dry on the contract that you've gone through and actually done an IT resourcing plan with the provider to ensure that they have the adequate bandwidth, time, attention, focus in order to implement the solution. What that resulted in, about 27% higher success rate in implementation, which of course for this digital health vendor meant quicker time to revenue, better success in case stories as well. I think the first thing we would look at is that the level of investment this year from institutional investors, PE companies, whatever it might be, has been lower than I think what a lot of individuals anticipated. Now, the good news is that a lot of these organizations and investors are sitting on a lot of cash, and they're looking for the right time to deploy their resources, their investments. With that being said, we do believe there's going to be tremendous M&A activity uptick in the market. And just maybe as a data point that I find interesting is we recently went out, we talked to hundreds of digital health companies, and 64% said we had either just experienced an M&A event or we anticipate an M&A event in the next 12 months. Now, that's interesting in itself because it indicates a high level of activity in the market. However, what we also then double clicked into is that less than half of those organizations cited that the commercial integration, essentially the combination of marketing, sales, and service teams, was seen as successful after that acquisition or integration event. And it's kind of interesting to kind of look at that and say, even though we expect to see a lot more investment into digital health and therefore vertical and horizontal integration overall and consolidation within the within the industry, it really also highlights the need to say, before you go out and put together an investment thesis, you really have to think about that commercial model and what it's going to look like. How do we represent our product back to the customer? How do we ensure that we've got a compelling value proposition, and what does that look like, and how does that drive not just the investment thesis but also the post-acquisition value creation plan? The last thing I'd probably also mention, which we also look at, is part of this horizontal and vertical integration that we're seeing driven by consolidation and outside investment is also aligning with what the buyers are telling us they need. A recent provider study, we went out and talked to quite a few hospital executives, and the overwhelming consensus is that they were more apt to buy stack products, i.e. multiple offerings from a single vendor, as opposed to best-in-breed products from multiple vendors. Probably more around the ease of implementation, also ease of dealing with one vendor, probably some leverage there as well in terms of value when it comes to pricing, but the appetite is there. And so as more horizontal and vertical integration occurs, we expect that to get a lot of steam and momentum in the marketplace. Great question. Here at HIMSS, you cannot walk 5-10 feet without getting hit in the face with another AI message. And so maybe what I'll do is I'll put the AI product conversation off because it's rather complex, and instead focus on AI as it pertains to digital health organizations and how they enable their team, as well as how they engage their buyers. And we've identified quite a few use cases, 3 or 4 within marketing, 3 within sales, 4 within service or post-land, where artificial intelligence is helping commercial models be more effective. Over half of commercial leaders use some form of artificial intelligence today for content creation. About 47% of sales leaders are using artificial intelligence to help with forecasting in pipeline. And so you're already starting to see this kind of enablement and engagement AI proliferation. We expect that to continue. And I think we heard it very loud and clear is that artificial intelligence is not going to replace sellers or marketers or customer success managers. What it's going to do is it's going to allow those individuals and those organizations that embrace artificial intelligence and AI capabilities to just do their job that much better and be more effective. And so we do anticipate some level of kind of bifurcation of companies that embrace AI and high levels of performance and those that are kind of left behind. Yeah, I think going back to what we mentioned before, just a high level of consolidation and being cognizant of what that means. As a small and growing digital health organization, you should be thinking about who can I acquire, how can I bring new products to market, or what does it look like if I am acquired? Because at some point, these are realities in the market. They're events. The other thing I think we're likely going to see, and we see it here again at HIMSS everywhere, is these traditional non-healthcare organizations pushing their way into the digital health arena and making large, substantial acquisitions to get a foothold in the market. And so we certainly kind of anticipate those trends to continue. I think just in general is status quo is not going to keep you at the top of the market. And so continuously looking at your commercial model, looking at how it can evolve, being ruthless in terms of how you measure success, and be prepared for the change that is inevitable to come. Absolutely. At the Alexander Group, we're continuing to put out good content, benchmarks, and points of view that we believe there's a deficit in the market of this information. And so we're running quarterly virtual roundtables. We're continuously sharing our points of view as well as our proprietary database around commercial data points, spans of control, pay levels, productivity per rep. And we just get really excited about sharing that content overall and just partnering with the digital health community.